Alkaptonuria is a rare genetic disorder caused by the deficiency of an enzyme called homogentisate 1,2 dioxygenase, which is involved in the breakdown of the amino acids phenylalanine and tyrosine. As a result, a substance called homogentisic acid accumulates in the body and is excreted in the urine, leading to its darkening upon exposure to air. The condition can also cause joint pain and stiffness due to the deposition of this acid in connective tissues, a phenomenon known as ochronosis. Alkaptonuria is inherited in an autosomal recessive manner, meaning both copies of the gene must be mutated for the disorder to manifest. Ataxia telangiectasia is a rare, inherited disorder that affects the nervous system and the immune system, characterized by progressive difficulty with movement, ataxia, and the presence of small dilated blood vessels, telangiectasia, on the skin and eyes. It is caused by mutations in the ATM gene, which plays a crucial role in repairing DNA damage. Individuals with ataxia telangiectasia often experience neurological symptoms such as unsteady gait and coordination problems, along with an increased risk of infections and certain types of cancer. The condition typically manifests in early childhood and can lead to various complications as the individual ages. Cyanide poisoning occurs when a person is exposed to cyanide, a highly toxic chemical that can disrupt the body's ability to use oxygen. Cyanide can enter the body through inhalation, ingestion, or skin contact, and is often found in certain industrial settings, as well as in smoke from burning plastics and other materials. Symptoms of cyanide poisoning may include headache, dizziness, shortness of breath, confusion, and a cherry red appearance of the skin. If left untreated, it can lead to severe health consequences, including loss of consciousness and death. Immediate medical attention is crucial for effective treatment, which may involve administering antidotes such as hydroxycobalamin. Down syndrome is a genetic condition caused by the presence of an extra copy of chromosome 21, leading to developmental and physical challenges. This condition is characterized by distinct facial features, such as a flat facial profile and slanted eyes, as well as varying degrees of intellectual disability and developmental delays. Individuals with Down syndrome may also have associated health issues, including heart defects and respiratory problems. The severity of symptoms can vary widely among those affected, but with early intervention and support, many individuals with Down syndrome can lead fulfilling lives and achieve significant milestones. Duchenne muscular dystrophy, DMD, is a severe genetic disorder characterized by progressive muscle degeneration and weakness, primarily affecting boys. It is caused by mutations in the dystrophin gene, which is essential for maintaining muscle cell structure. Symptoms usually appear in early childhood, often around ages 2 to 6, and may include difficulty walking, frequent falls, and challenges with running or jumping. As the disease progresses, muscle weakness spreads to other parts of the body, leading to loss of mobility and, eventually, respiratory and cardiac complications. While there is currently no cure, supportive treatments and therapies can help manage symptoms and improve quality of life for those affected. Ehlers-Danlos syndrome, EDS, is a group of inherited connective tissue disorders that affect the skin, joints, and blood vessel walls, leading to symptoms such as hyperflexible joints, fragile skin, and an increased risk of bruising and injury. The condition is caused by genetic mutations that affect collagen, a protein that provides strength and elasticity to connective tissues. There are several types of EDS, each with varying symptoms and severity, ranging from mild to life-threatening complications. Individuals with EDS may experience chronic pain, joint dislocations, and other related issues. And while there is no cure, management strategies focus on improving quality of life and preventing complications. Familial hypercholesterolemia, FH, is a genetic disorder characterized by extremely high levels of cholesterol in the blood, specifically low-density lipoprotein, LDL, cholesterol, which can lead to an increased risk of cardiovascular diseases such as heart attacks and strokes at an early age. It is caused by mutations in genes responsible for the metabolism of cholesterol, most commonly the LDL receptor gene. Individuals with FH typically have a family history of high cholesterol and related health issues. The condition can be inherited in an autosomal dominant manner, meaning that only one copy of the mutated gene from a parent is needed for the disorder to manifest. Early diagnosis and treatment, including lifestyle changes and medications, are crucial for managing cholesterol levels and reducing the risk of heart disease. Fragile X syndrome is a genetic disorder caused by a mutation in the FMR1 gene on the X chromosome, leading to intellectual disability and developmental delays, particularly in males. It is the most common inherited form of intellectual disability and is often associated with behavioral challenges such as anxiety and attention deficits, as well as physical features like a long face and large ears. The severity of symptoms can vary widely among affected individuals, with some experiencing mild learning difficulties and others facing more significant challenges. Fragile X syndrome is inherited in an X-linked dominant pattern, meaning that the gene mutation can be passed from a mother to her children, significantly impacting both males and females. Although males tend to exhibit more pronounced symptoms. Fructose intolerance, also known as hereditary fructose intolerance, HFI, is a genetic disorder that affects the body's ability to metabolize fructose, a sugar found in many fruits, vegetables, and sweeteners. This condition is caused by a deficiency of the enzyme aldolase B, which is necessary for breaking down fructose in the liver. Individuals with fructose intolerance may experience symptoms such as abdominal pain, bloating, nausea, and vomiting after consuming foods containing fructose. If left untreated, it can lead to serious complications, including liver and kidney damage. The primary treatment for HFI is a strict avoidance of fructose and sucrose in the diet, which helps prevent symptoms and associated health issues. Homocystinuria is a rare genetic disorder that results from the body's inability to properly process the amino acid methionine, leading to an accumulation of homocysteine in the blood and urine. It is caused by mutations in genes responsible for enzymes involved in the metabolism of homocysteine, most commonly the cystathionine beta synthase, CBS, enzyme. Symptoms of homocystinuria can vary widely and may include developmental delays, vision problems, skeletal abnormalities, and an increased risk of cardiovascular disease. Early diagnosis through newborn screening and appropriate treatment, which may include dietary changes and vitamin supplementation, such as vitamin B6, B12, and folate, can help manage the condition and reduce the risk of complications. Hurler syndrome, also known as mucopolysaccharidosis type I, MPSI, is a rare genetic disorder caused by a deficiency of the enzyme alpha-L-iduronidase, which is necessary for breaking down certain complex carbohydrates called glycosaminoglycans. This deficiency leads to the accumulation of these substances in various tissues, resulting in a range of symptoms, including developmental delays, distinctive facial features, skeletal abnormalities, and organ enlargement. Children with Hurler syndrome often experience progressive symptoms, including heart and respiratory problems, and typically have a shortened lifespan if left untreated. early diagnosis and treatment options, such as enzyme replacement therapy and hematopoietic stem cell transplantation, can help manage symptoms and improve quality of life. Carter-Jenner syndrome is a rare genetic condition characterized by a triad of symptoms: situs inversus, a reversal of internal organ positions, chronic sinusitis, and bronchiectasis, dilated and damaged airways in the lungs. It results from a defect in the cilia, tiny hair-like structures that help clear mucus and debris from the respiratory tract, leading to recurrent respiratory infections and issues with mucus clearance. The condition is caused by mutations affecting the structure and function of cilia, which are essential for normal bodily functions. Individuals with Carter-Jenner syndrome often experience a range of respiratory problems, and management typically focuses on treating infections and maintaining lung function through regular medical care. Lesch-Nyhan syndrome is a rare genetic disorder caused by a deficiency of the enzyme hypoxanthine guanine phosphoribosyltransferase, HPRT, which is involved in purine metabolism. This deficiency leads to an accumulation of uric acid in the body, resulting in symptoms such as gout, kidney stones, and excessive urination. Individuals with Lesch-Nyhan syndrome also exhibit neurological and behavioral symptoms, including intellectual disability, self-injurious behavior, and movement disorders. The condition primarily affects males and is inherited in an X-linked recessive pattern. While there is no cure, management strategies focus on controlling uric acid levels and providing supportive therapies to address behavioral and physical symptoms. McArdle disease, also known as glycogen storage disease type V, is a rare genetic disorder caused by a deficiency of the enzyme muscle phosphorylase, which is essential for breaking down glycogen into glucose for energy during physical activity. Individuals with McArdle disease often experience symptoms such as muscle cramps, fatigue, and weakness during exercise, particularly in activities that require bursts of energy, like sprinting or lifting heavy objects. They may also experience myoglobinuria, a condition where muscle breakdown leads to the release of myoglobin into the urine, which can cause kidney damage. McArdle disease is inherited in an autosomal recessive manner, and while there is no cure, management typically involves avoiding strenuous exercise and maintaining a balanced diet to help manage symptoms. Phenylketonuria, PKU, is a genetic disorder caused by a deficiency of the enzyme phenylalanine hydroxylase, which is responsible for converting the amino acid phenylalanine into tyrosine. When this enzyme is lacking, phenylalanine builds up to toxic levels in the body, potentially leading to severe intellectual disability and other neurological issues if not managed. PKU is typically detected through newborn screening, allowing for early dietary intervention. Individuals with PKU must adhere to a strict low phenylalanine diet, avoiding high-protein foods and certain artificial sweeteners to prevent complications and support normal development. With proper management, individuals with PKU can lead healthy lives. Pyruvate dehydrogenase deficiency is a rare genetic disorder that affects the body's ability to convert pyruvate, a product of glucose metabolism, into acetyl-CoA, an essential molecule for energy production in cells. This deficiency results from mutations in the genes that code for the pyruvate dehydrogenase complex, leading to an accumulation of pyruvate and lactate, which can cause a range of symptoms, including neurological issues, developmental delays, and metabolic acidosis. Symptoms often present in infancy or early childhood, and affected individuals may experience episodes of lethargy, muscle weakness, and seizures. Management typically involves dietary modifications, supplementation with specific nutrients, and supportive care to help alleviate symptoms and improve quality of life. Tay-Sachs disease is a rare genetic disorder caused by a deficiency of the enzyme hexosaminidase A, which is necessary for breaking down a fatty substance called GM2 ganglioside in the brain and nerve cells. The accumulation of GM2 ganglioside leads to progressive neurological damage, resulting in symptoms such as developmental delays, loss of motor skills, seizures, and vision and hearing loss. Tay-Sachs is most commonly found in individuals of Ashkenazi Jewish descent and is inherited in an autosomal recessive pattern. Unfortunately, there is currently no cure for Tay-Sachs disease, and management focuses on supportive care to improve quality of life and address symptoms as they arise. Vitamin B1 deficiency, also known as thiamine deficiency, occurs when the body does not get enough thiamine, an essential nutrient that plays a crucial role in energy metabolism and the functioning of the nervous system. This deficiency can lead to various health issues, including beriberi, which is characterized by symptoms such as weakness, fatigue, nerve damage, and cardiovascular problems. Another condition associated with thiamine deficiency is Wernicke-Korsakoff syndrome, which affects brain function and can cause confusion, memory loss, and coordination difficulties. Common causes of vitamin B1 deficiency include malnutrition, alcoholism, and certain medical conditions that affect absorption. Treatment typically involves dietary changes and thiamine supplementation to restore adequate levels and alleviate symptoms. Wiskott-Aldrich syndrome is a rare genetic disorder that primarily affects males and is characterized by a triad of symptoms: eczema, recurrent infections due to immunodeficiency, and thrombocytopenia, low platelet count, which can lead to easy bruising and bleeding. The condition is caused by mutations in the WAS gene, which plays a role in the function of immune cells and platelets. Individuals with Wiskott-Aldrich syndrome have an increased risk of autoimmune diseases and certain types of cancer. Management typically involves treating the symptoms, such as managing infections and eczema, and may require more intensive treatments, including immunoglobulin replacement therapy or even hematopoietic stem cell transplantation in severe cases.